Hey everybody, and welcome to my channel. I'm Nadia, and this is Patience and Patience, where I talk about motherhood, nursing, being the wife of a medical resident life, and basically anything else that I want to talk about. In today's video, I am going to be covering how to give report for the cardiac and respiratory systems. So this video belongs to a series of report giving videos that I have recorded, the first of which discusses the outline of your report. The second discusses the neuro portion of your report, and this is the third section where we will be talking about the cardiac and respiratory system. If you're a new nurse or a novice nurse looking for a way to organize and streamline your report, this video is for you. Go ahead and put the cardiac and respiratory systems together in a single video rather than separating them into two separate sections. And the reason for that is because a lot of people tend to mismatch the two of them and discuss maybe the respiratory system before the cardiac system or vice versa. I personally do the same thing. It just depends on how intense each system is. So if the patient has a more intense cardiac system, then I'm likely to talk about the cardiac system before I talk about the respiratory system. But as we all know, the respiratory and cardiac systems, they do go hand in hand and they complement each other and they work together pretty closely. And so honestly, it doesn't really matter which one you discuss first, as long as you discuss them both in depth and in detail. So I will talk about the cardiac system first because that tends to be the one that most people favor above the respiratory system. And so when I talk about the cardiac system in my report, number one, the first thing that I like to talk about is my patient's vital signs. And the reason for this is because the discussion of the patient's vital sign kind of gives like an entire image of like how your patient is doing. And so my first thing that I'm going to say is whatever you do not say vital signs are stable and just leave it at that, or vital signs within normal limits. I had the pleasure of attending in a conference with the American Association for Critical Care Nurses, and I sat in on one of the legal discussions that they were having, or the legal discussions that they were having. And so the lady that was talking to us was a lawyer, and she basically said that a lot of nurses tend to document in their documentation that vital signs are within normal limits, or they are stable, or whatever it may be, but that we document stable or within normal limits. Now, the problem with this is, in legal terms, there is no legend as to what within normal limits means or what stable really means. And so if you're going to use that terminology, you have to back it up with what you mean. Vital signs stable, systolic blood pressure between 110 to 120 or something like that, where you're actually explaining what the range of that patient's vital sign actually is, rather than just leaving it up for interpretation. So the same thing with like when you're giving a report, although giving a report is technically not like a legal document, obviously, but you want to be as thorough as possible. And so when talking about vital signs, it's really a good idea to give the nurse that you're giving a report to a range so that he or she can actually understand what exactly you mean by stable. The next thing I want to discuss is my patient's cardiac rhythm. If you're working in the ICU or in a telemetry unit, it's really important for you as a nurse to be able to interpret EKG strips. That being said, you don't actually have to know how to read 12 lead, although that's probably a really good skill to have, and it could probably, make your work that much easier. But if you are not skilled in learning or in understanding 12 lead EKGs, that's okay. But you need to understand how to read a regular rhythm strip as it comes up on the EKG monitor. You need to know how to do that. So I'm going to go ahead and link a book down below that I use that was actually introduced to me by a cardiologist that I used to work for. The book is thorough, it's very simple, it goes into detail, but it's simple to understand. So I'll go ahead and link that book down below. Hopefully your patient is stable and your EKG rhythm has been stable from the beginning of your shift to the end of your shift. However, sometimes what happens to patients is they have ectopic beats, or they have like problems with their EKG rhythm. Like maybe they go into AFib, or maybe they go into SVT, or rapid A flutter, or what have you. These are details you do not want to miss when you're giving a report, because Number one, if you noticed it, that's great. Call the doctor, let the doctor know. Number two, if the doctor made an intervention or ordered an intervention or, you know, told you that, you know what, that patient does that, I'm not really concerned, we're just going to keep monitoring it. Whatever it is, if you had a conversation with the doctor, it's important for you to pass over that information to the nurse that's getting report from you, because that nurse is going to be responsible for the care of that patient for the next 12-hour shift. You know, you don't want to be that nurse that called and didn't say anything, and then your co-nurse ends up having the same problem in their shift. And the worst is if it's during the night shift and they have that problem, and then they call the doctor at like 2 o'clock in the morning, and he or she gets upset because it's like, I already told Nurse Nadia this, and that. There's a note in there. She should have, like, you know, put the order in the computer or what have you. Why are you bothering me at 2 o'clock in the morning? Do not be that nurse, because your co-nurse is going to be really upset with you when you come back the next day. And then, of course, if any medications are ordered for your patients, any drips or, you know, any kind of like rate regulating medication such as digoxin or anything like that were given, you want to discuss those in the cardiac section of your report. And then you also want to touch base upon like how your patient reacted to these medications. I also like to talk about like the blood pressure medications that my patient has, the scheduled medications. So these are not like Levophed or neosynephrine or any kind of medications that can help with blood pressure that we're giving extra, you know what I'm saying? But medications that are on schedule, like lisinopril or hydralazine or something like that, your patient takes on a schedule to let the nurse know like how their blood pressure actually reacts to it. A lot of times patients will have like what we think is considered normal blood pressure, like say like 130 or something like that, and they have an order for a medication like hydralazine. Well, you know, their blood pressure is 130 because they're actually taking their medication. But a lot of times what I've seen like from new nurses or nurses in like floors that are not really high acuity is that they will see this blood pressure and they make their nursing judgment and they decide that they're not going to give that medication to your patient. And then when you come on shift or when you take over the care of that patient, all of a sudden your patient's blood pressure is like in the 170s because they missed their dose because that nurse made a judgment. And so sometimes it's really good to like discuss those like blood pressure changes or heart rate changes in correlation with medication that the patient takes. Now, if you're working in a unit that is like a cardiac based unit, of course, you're going to have a lot more detail to talk about. Unfortunately, I have not worked in a cardiac setting in a very, very long time. So the next section will be the respiratory section. So in the respiratory section, obviously we're talking about the lungs, we're talking about the breathing. And so first and foremost, we want to, or I like to discuss like how my patient is breathing. And what I mean by that is what exactly are they using to breathe? So before like I go into the detail, I'm going to go off on a huge tangent. Now my number one pet peeve with discussion of the respiratory system in report is when the nurse does not know what the settings of the ventilator are. Not every patient's going to be on a ventilator, obviously. Some patients will be breathing room air. Other patients will be on like 2 liters of oxygen. Some patients on BiPAP. And some patients will be on a ventilator. And so if your patient is on BiPAP or if your patient is on a ventilator, so BiPAP is kind of like, for those of you who don't know, it's a mask that patients will wear. Sometimes it's a triangular mask like this that goes around the nose and the chin to basically create a seal. And other times there's like the fireman mask that goes around the entire face. Now, this mask is connected to a machine that's called the BiPAP. And the machine has like various settings where it's basically like the last step before going on a ventilator. At least that's the way I see it, where we push positive pressure down into the patient's lungs to keep them open and to keep the alveoli expanded, and so that the patient can ventilate appropriately. A lot of times patients with COPD will be seen on these machines, or patients that have sleep apnea. And the whole point is to reduce the amount of trapped CO2 in their lungs and help them expel that CO2 so they don't become acidotic. So if your patient has a BiPAP, it's very important for you to know what those BiPAP settings are. Just the very same way, you need to know what the patient's ventilator settings are. I have got a report a lot of times from ER nurses. Usually it's the ER nurses. I'm not trying to like diss ER nurses. They're amazing. They deal with a lot of like high acuity patients. They deal with a lot of like the quantity of patients that they take care of. They're in a very like fast-paced environment, and their main goal is to stabilize the patient and ship them out. And I totally understand. I get it. It's busy. It's crazy. I understand. But at the very least, it's very important for you as a nurse that's caring for a patient to understand how your patient is breathing. What vent settings did your patient have? It's not okay to just know that your patient is on a ventilator, because when we look at a ventilator, there's very many settings. On the high end, you have event settings where your patient is basically relying on the machine. They're not initiating any breath. The machine is giving them full volume. It's also controlling the rate at which your patient is breathing. It's controlling literally everything. And then on the far end, the other far end, you have the vent settings where your patient is actually initiating breaths. They're just getting like maybe a little bit of support, or perhaps it's like the practice event settings where basically they're on CPAP and they're just controlling their own rate and they're doing it all. And just in case they don't, the machine will take care of them, but they're basically almost ready to get extubated. And so it's really, really important to me as a nurse getting a report from you to know where on the spectrum my patient is. So I need to know how my patient is breathing. And so that's really important. Another thing I like to discuss, especially if my patient is intubated, is their secretions. Like, what do their secretions look like? How much secretions do they actually have, or do they have any at all? And if they do, or if they came in and, you know, they got intubated and they had copious amounts of secretions, did you send some secretions to the lab or something like that? You would probably want to discuss that as well. Another important thing, and I think I kind of got like ahead of myself, if the patient did not come to your unit intubated and then they became intubated because something happened, it would really be a good idea to explain exactly what happened. A lot of times, like, patients will end up being intubated after they had a meal and they were lethargic and they aspirated or something like that. And so to pass that information on to the nurse is really good, because when they do get extubated, that gives like the nurse, whoever's in charge of taking care of that patient post extubation, the indication that maybe they need to monitor this patient very, very closely, or get a speech therapy evaluation in order to get that patient to eat before giving them anything orally. And so those are things that I want to discuss. So do not forget to like check your ventilator settings. Now, I know as a new grad or as a new nurse, or sometimes like we don't really understand what the vent settings mean or anything like that. Now, if you don't understand, and you have a preceptor, ask your preceptor, but most times your nursing preceptor will point you in the direction of the respiratory therapist. And honestly, that is the best person to ask about ventilator settings. They know vents because that's basically all they focus on. They focus on breathing. And so they know everything that is needed to know about like how the ventilator works, what the settings are, what exactly those settings mean. And that's actually a really good way for you to get your information. What else? So another thing that you can discuss in this section of the report is any kind of diagnostic tests, whether it's a VQ scan, which is a ventilation and perfusion scan, a chest x-ray, an MRI, a CT of the chest, ABGs. If your patient happened to have ABGs because they were in respiratory distress or something like that, and you know, we noticed that the lab values were all out of whack, and you made ventilator changes or you made changes to their regimen, maybe they were given some bicarb because they were acidotic or what have you, this would be the section that you would discuss that in. And I think that's basically it. The respiratory system is actually a very, very important system, but it's also like a more simple system to discuss. Before I forget, if your patient has any breathing treatments or anything like that, you want to discuss that in this section as well. And so that's basically it. It's pretty easy in a nutshell. I might do a video a little bit later on dumbing down the ventilator settings and talking about like what each of them mean. Do keep in mind that every hospital probably has like different terminology for the ventilator settings, and that's usually due to the fact that each ventilator company probably has like a different name for their vent settings. And so like I worked at a place where they had the setting called PRVC, which is pressure regulated volume control, as opposed to using like AC mode. And so it just depends. So yeah, so that's the cardiac and the respiratory system. If you liked this video, go ahead and give it a thumbs up. I really hope it was useful for you. If you want to see more videos like this, go ahead and hit the subscribe button. And if you have any questions about this video or the videos prior to it, or anything nursing related that you might want me to make into a video, go ahead and leave me a comment down below, and I will see you in the next video.